Hello, we're talking about hyperglycemia. Remember, we talked about hypoglycemia and now we're talking about hyperglycemia. So hyperglycemia is the opposite of hypoglycemia. So hyperglycemia simply means high blood sugar in the body. And what is high blood sugar? You normally have a target. Every human being have got a target. My target is between 5 and 14. So anything above 5 is normal for me. Some people own is 4.8 to let me say 12. So it depends. So if you want to know the normal human blood sugar level limits, the acceptable range, you can actually Google that as well. It's out there. I've put it in my first video. So now, hyperglycemia simply means high sugar level consistently after meal or persistently above target level. So it's mostly common and associated with people that are diabetic, whether type 1 or type 2. So when this happens, what do you do? That is a question. So all you need to do in this video is to listen, because it's going to help you. It's going to help you save your own self, save a soul in your household or someone out there. Now, what are the causes of hyperglycemia? Too little insulin or missed diabetic medications can cause that. So if you're out there on diabetic medication, you're not taking it, you're not doing yourself, your doctor, anything, you're rather putting yourself in more harm. So you don't need to do all that. So eating too many carbohydrates can cause hyperglycemia as well. So that is why you need to check your carbohydrate intake. Also, illness, infection, stress, and hormone rise can also raise the sugar level as well in the body. So that is why sometimes they rule out quite a lot of factors. So now you've known what the causes of hyperglycemia. How about activity? So lack of physical activities. Yes, lack of insulin resistance simply means it's mostly common in people with type 2 diabetes or people that are pre-diabetic. So insulin resistance can also cause high sugar level in the body as well. So what are other causes? So certain medications like steroids, hormonal disorder, or Cushing syndrome or severe dehydration can as well cause that. So what are the symptoms of hyperglycemia? One of the symptoms, one of the things that you need to know, the reason why you need to watch this video to the end, because it's going to help you. So one of the symptoms are, we have what we call the mild to the early to mild, or early or mild. So now the first one is increased thirst. You're always feeling thirsty to drink. Then frequent urination. We also have the fatigue. We have the blurred vision. We have the headache. So these are the mild symptoms. Then we have what we call the severe or dangerous symptoms. And in this case, you really need to make sure you get help immediately. What are those? Your nausea, vomiting, abdominal pain, swelling breath, rapid breathing, confusion, or drowsiness. So severe hyperglycemia can lead to diabetic ketoacidosis. What do I mean by that? That simply means that you need medical emergency at this point in time. So I hope now you know what the difference is with what hypoglycemia is and hyperglycemia. Hypoglycemia, like I said in my previous video, is just the low sugar level. Hyperglycemia is the opposite of it, which is the high sugar level. So when you're noticing that, I've told you what the causes are and what the symptoms are, and then how you need to get help. I've told you how to treat hypo in my previous videos, and this one you need to know what are the causes and try to prevent those causes. So if you have age parents that are diabetic, this is how you look after them. So when you see all these symptoms, you should be able to know how to help them and when to call for emergency help and when you can intervene as well to also help them. Don't forget, mild to moderate hyperglycemia. You need to always regularly check your sugar level. I've told you about checking your sugar level, which I brought up my kit earlier on, which I said you need your sugar monitoring. This is what we have, this meter, we have this one, and then you also have the this one as well. So you use to pierce your skin. You use the straps out of this here and you put it here. Put it here and use that to check your sugar level. So that's why you need to check your blood, your glucose level regularly. Drink plenty of water to prevent being dehydrated. Then you need to do physical activity. If not, if no, ketones present, please. And also, if your sugar level is really high, you need to check your ketone level as well, because the last thing you want is to go into shock. Nobody wants that. So please, you have to treat hyperglycemia as severe if it's above the limit I've just told you about. Then eat balanced meal. Also adjust insulin or oral medications as prescribed. So when you're being prescribed these medications, take it. And if you feel your medication is not working as required, you are on your medications, you're taking them, and then your sugar level is still very high, After maybe a couple of, if you've had it consistently high for 7 days, report that back to your GP and they can review your medication as well. If you do not speak to your GP, they wouldn't know what is going on in your life. So you have to tell your GP, I've had my medication for 10 days. It's been very, very high, way above my limit. So would you mind checking my blood level, or would you mind checking, review my medication? The GP will be more than happy to assist you. But then in the first instance, you have a lot of role to play. When I mean a lot of role to play, you take these medications, you are the one suffering from this, so you need to take your health seriously. Check your sugar level. You don't have to be diabetic before you start checking your sugar level. Or I have told you, these are things that you need to have as you have your first aid kit. You need to have all this kit for all these things in your home, so you can save a soul. You save of your soul. You can save your life, the life of your children, your loved ones, your parents, and your friends as well. You can even save souls out there in the community. So that is why it is very, very important. Now, prevention: take diabetic medications as prescribed. Like I said, monitor sugar level regularly, follow a balanced diet, eating plan, manage stress and illness carefully, please, and stay physically active. I hope this video does make sense. And if you're still wondering what hyperglycemia is, don't forget, in one word, hyperglycemia simply means high sugar level. I have told you what the causes are, the treatment plan, and the symptoms. So I hope this video does make sense. And kindly like, share, and subscribe, and I will see you in my next video. Bye.